everybody. I'm Konstantin Vasyuk. I'm CEO of IT Ukraine Associations, and next 30 minutes we will talk about digital transformation of the healthcare sector in Ukraine, but not just simple digital transformation in the normal conditions. We will be speaking about the status of these issues during the war, the barbaric war which we have now, full-scale war from Russia, and we are fighting for our freedom, for our country, for our future. And by the way, today we have the day of military of Ukrainian army. So exactly this time, I would like to say that generally we have this road show here, and this event is a part of the road show which we perform together with our partners, with IT Ukraine Association and USAID. And now I think that it's time to share some experience and some thoughts regarding how we really not just survive, how we develop our industry. Because since started, let's say 30 years ago, our industry has started like a small economy sector. Now we had almost $10 billion export, and we have more than 300,000 people, IT specialists, working in it. So, but just to go straight to our topic, I would like to speak, when we will be speaking about opportunities and other things, I would like to introduce our session speakers, our panel discussion speakers. So first of all, Walid bin Khalid, Head of Digital Transformation in London at Computools.
Hello, my name is Walid and I am the Head of Digital Transformation at Computools. We are a full-service software solution company that help companies unlock tomorrow.
Thank you. And Timur Farajev, Head of Delivery of Cox Software.
Yeah, thanks. Hey, Cox Software here. We are delivering software, custom software products to our clients for more than a decade, and health tech is one of our main domains in the industry.
Okay, thank you. Let me introduce Anton Skripnik, CEO of KindGeek.
Hello, I'm Anton. I'm representing the group of companies, 6 companies, which unites the direction of healthcare, military tech, fintech solutions, and education. So in healthcare, we automate more than 1,200 of hospitals in Ukraine, including military defense.
Thank you. And Igor Polic, CEO of DevLight.
Hi all, I'm Igor Polic from DevLight. DevLight creates a variety of digital different products, mostly dedicated to mobile platforms. So the 40% of our revenue comes from healthcare tech, so I have a lot of insights to share. Thank you, Konstantin, for inviting me for such an important discussion. Hope you will enjoy.
Thank you. So, and of course, when we're speaking about Ukrainian tech industry, we know that very high level of expertise and digital skills was and still here, was before war and is here. But I would like to address just general question to each of you. So you know, after 24th February, everything's dramatically changed, not only in Ukraine, but I would like to say in the world, because now we have unbelievable and unpredictable challenges for business, for society, for each of us. And what about your business? What about your companies? How you transformed your priorities, business processes, and of course in connection with the products during this period? Because we have almost nine months of the war. Please just comment this.
Who will start? Maybe me.
Yes, please.
So I think that we have a good training, first of all, with COVID time, which give us a little bit more preparation. So nobody had prepared to war, but in general, we received a little bit more preparation because of the COVID. And now I believe every company can write the book about business continuity plans, like, you know, in actions, not in words, but in actions. So in general, everything is ok, as fine as it could be in this time. But yeah, well, we are continue. We are doing business as usual. and hope to find here new partners.
Yeah, okay. And what about the customers? I mean, do they really feel some changes or disruptions or something wrong?
If to talk about our group of company, then no. We even we think about ourselves as the data-driven agile organization. So we are measuring data very accurately about performance, and in our surprise, the general performance go up. So
Oh, it's unbelievable. Yeah.
Yeah, to add to that, I think everyone in this room and knows this phrase "be brave like Ukraine," and it's true. Like, we are companies who didn't fall. We continued our delivery. We didn't stop any of our projects. Delivered everything on time, and we are proud of it. And we are doing it under all the circumstances, under shellings, etc., in bomb shelters. But our main point here is don't be scared of that. We are there. We know how to deal with it. Just do business with us. We'll take care of the rest, right? Speaking of products and of, let's say, things that we as a company do and did, like before the war, our 99% of clients were clients of US, Europe, UK, so working primarily for the West. Then 24th of February this year has changed everything. We shifted. We are also mobilized for Ukraine. And the products that we did before were like mental health, some startups in IoT sector for healthcare at home, to care for those who need it, the elderly, the people with disabilities. And now Ukraine has new challenges, which is also mental health and prosthetics and other things. And we are here, and one of the products that we did in partnership with our US organization, charity organization, we adopted a German system for supply management for hospitals. We adopted it technically and visually for Ukraine, and many of the nice hospitals in Ukraine are using it in order to manage their needs, their supplies, to share it with those who need it. And yeah, we are open for new products and solutions. We are ready to jump in and help Ukraine and join the forces of international community to let Ukraine win.
Oh, Timur, thank you. And Walid, what about, let's say, does war dramatically changed something in your business, in your approaches, exactly about healthcare issue, because the products are you dealing with related, as I know, with this area?
Of course. I mean, like, I would like to say here that we always had like a crisis management plan in place. So if in any case, any kind of a crisis would come, we would have the right plan to overcome it. So we always had that. So when 24th Feb, like you said, the war started, I wouldn't say that in terms of our business, a lot of things dramatically changed. Of course, we had to move a couple of things here and there, and we had to fall back to our crisis management plan, but we had an idea of what we are doing. So in terms of healthcare, right now, as Timur said, mental health is one of the biggest challenges that we are facing in Ukraine, and to support our people, to give them, let's say, the right exposure to mental health support, to have psychologists, to have psychiatrists, have sessions with them. We are working with different communities, we are working with different organizations in order to provide support to Ukrainians who are suffering from these issues. On top of that, I would like to add another thing over here, that we do need physical examinations every now and then when we feel bad, but we are trying to make sure that doctors are available for, let's say, for example, an online consultation, for consulting, if somebody's feeling bad, just to have that kind of support as well. Let's say, for example, you have a fever, you have some symptoms, you can call up a doctor, you can log into an app, you can reach out to a healthcare professional who can at least guide you in terms of what your next step should be. Because at the moment in Ukraine, not everything is super accessible because of the war, because of the shelling, because of all that is going on. So just to make the life of people more comfortable, healthcare more accessible, we are trying our best in the field. We are behind our screens. We are working day and night just to provide these solutions for our people and supporting them in any way that we can to make their lives better.
Oh, interesting, Igor. And do you know maybe some cases regarding how healthcare technology and generally like in trend can be collaborate or just create new sectors and new niches with military or around military topics? I know that Anton also knows this, but will add. But I would like to see your to look at your site. Yeah.
Okay, so from what I see in Ukraine for now, one of the most trending sector is of course military tech, because it's, how to say, it's like just more mostly needed sector. But I want to how to say, to stay this answer to Anton because he's most experienced, and share some my insight about healthcare technology in Ukraine for now. So first of all, I disagree with my colleagues about the accessibility of Ukraine, because even before the war and now we are one of the most developed countries speaking about the accessibility of digital health, digital services at all, both about the government side and both about the private side. So as it was mentioned from me at the beginning, we are working mostly in the health tech sphere, and what we are seeing in Ukraine. So first of all, both government and both private sector wants people to be involved in this process, and many companies got a challenge at the very beginning of how to continue support their clients in health tech project when war is coming, because there were three challenges. First of all, the war is coming and I need to find where I can buy my medicine. So different digital products came to play. The second, I was forced to move from my city or even to another country, where I can find the doctor, how can I book appointment, and so on and so on. And the first, as it was mentioned, mental health. So for many people, finally, the thing that the idea is very terrible, that the war is very terrible, is coming, and they are looking for some psychologists, they are looking for some mental support, and of course digital services are supporting all of those challenges, and they help us as Ukraine, as all society, as government to respond to them and successfully pass them. So from what I see, our Ukrainian IT community, especially healthcare community, are passing along all of those challenges, and we are very successful at it.
And okay, but if we're speaking about the, let's say, situation we have now, it's really full-scale war. Some territories injured. I mean, of Ukraine just blocked, and people went to the other regions. And do we now survive, or we are still pacing forward to new heights of technologies, optimizations? What is the real situation regarding the in real life? Yeah, because now we can have a lot of information from different sources, but when people go face to face with the problem, yeah, how these problems are solved or not? What is the state? Maybe you would comment, guys.
Okay, so I think speaking about different sources and different information, we haven't not to speculate about this information, because in the end of the day, in the most territory of Ukraine, everything is well, and we are continuing to developing our services, companies, and so on and so on. But speaking about, let's say, surviving, I think it's just one of the force which help us to become even more strongest.
Yeah, I agree with you, by the way, but I wanted to know that. Anton, please.
We as a company was participating in e-health transformation of Ukraine healthcare. So in our system we have 6 million of patients. This is a lot of data. And the patient that use our system, they have access to all their medical data on the phone, online and then offline. This helped them to during the relocation to still have access to the data and show it to another doctor, to contact the doctor that supporting them online. One of the challenges was during the evacuation, it's the absence of the internet. So what we delivered just in 2 weeks, we update the software for doctors to support the offline input of information, so the patient during the evacuation could be created earlier on the way, and when they get the access to the internet, the whole information going streamly to the system, and the team on the site of the hospital are already preparing and know what to do and how to help.
So it looks like the system you developed had already features which were activated just during this critical situation. I mean, they helped to find the way out. Yeah.
We do not have this feature. We had a great team. 100 of
but
people.
generally, technically, this product is available for upgrading and for tuning up to the exact demand of this moment, as I understood.
You are right. So we are working on this product called Dr. Elix since 2003. And we have 1,200 of installation in Ukraine and 200 in Europe. So this gives the good basement. And in Europe, when I talk in Europe, it's mostly Poland. So people of Ukraine who relocate to Poland, they still have access to their data, like already in Poland hospitals. So this gives the good basement for continual living, and yeah.
So maybe some comments. Yeah, something to add. Okay.
So, like my colleague said, in terms of evacuation, when people were getting evacuated and they had no access to internet and it was difficult, so something that was being done at that time was that doctors were able to create offline version of patient case histories. They were creating all of these things in their systems offline, and whenever they will have internet, all this data would be then transferred into the main systems which they were connected to the respective organization. So what we paid attention to in that moment was to document the details of every patient, even if there's not access to internet, no access to a computer, you could just do it in your phone. So instead of them just going into their notes and just taking down notes and then manually, just going through all that information again and putting it up, because time is of essence over here, we made sure that there were forms that they were doing offline, and then these automatically then get, into the system straight away when there is internet.
Oh, okay, thank you. And when we speak about this digital transformation in any sectors, any services which has been, let's say, transformed or being transforming, we think about the future. What future do you see regarding this new experience, regarding new expertise which we gain even from the battlefield as well? How it will be melted out, to the new maybe approaches, the new services. But of course, we're speaking about healthcare, we're speaking about the lives, not just killing people, but healing people, yeah? And what future do you foresee regarding this?
I would say here, the main point would be that right now attention to Ukraine is mostly around military, and we are here to raise a point here that health is needed, health sector is needed in Ukraine, and Ukraine now becomes giant health hub or market, let's say, in medicine, in prosthetics, all sorts of stuff, of products and services. So anything you can imagine with healthcare is needed in Ukraine. As you can see here, we know what we are speaking about. We've been there with West companies, with local companies in Ukraine. And yeah, join us and let's do it together.
Yeah, please, Anton.
Mayor. I believe that the next big digital transformation all over the world, not only in Ukraine, we actually started this process, would be AI copiloting that will help to make a better diagnostics and speed up the patient examination. So with like not making decision for the doctor, but helping him and streamlining the process and assisting him. So we already delivered like some parts of the systems already like 10 years that copiloting and minimizing examination time from 35 minutes to 6 minutes. And this was like the amazing breakthrough. And now we are going to the next step where we are bringing not only in copiloting based on the data points itself, but recognition from the voice, from the video, from the new way of thinking, a new way of supporting patients for making better decisions in the end of the day. So I think this will need to have not only transformation inside of the information system, but also from the standpoint of law and allowing, and who's that will be the responsibility of the final call and final decision, final prescription. Who's that will be the main responsibility in the end of the day. Yeah, but this is the future, and this is already today.
Yeah. And we should say as well that Ukrainian tech has been always like on the front line of new technologies and any projects you can even imagine. We were taking part in these projects, maybe limited sometimes by NDA and other things. Still, I mean that now the situation in Ukraine makes a good chance to attract attention to our expertise, which we have been already developing. But now we have this expertise growing, and that's why maybe the second one more comment regarding this future. Yeah, because it's important because we head into future.
Of course, we are heading into future, but one thing I think that we understood or we learned from the whole situation in Ukraine is that we need to digitalize all the medical records, everything around us, even in the rural areas. So there are some areas which are not yet completely digitalized, and that's the truth about those areas, because I wouldn't say they were forgotten, but I would say they were not the highest on priority lists, And I think that for those people living in those areas to get the medical care or the health care that they deserve, we need to work for them as well, and we need to do something in terms of providing them with solutions, providing them with, let's say, innovative technologies as well, which are abundant in your main cities. And another thing that I really believe in is that innovation should not be done just for the sake of innovation. We should understand completely what are we going to work with, because at the end of the day, people who'll be using these innovations are not going to be tech experts, they're going to be doctors. So we need to make sure that doctors understand the point, they understand the reason, and they understand how are they supposed to work with these sophisticated technologies that we are going to provide them with.
So that means that we are heading to some synergy of artificial intelligence and human expertise and other things. And by the way, summarizing our discussion. Maybe it's not a discussion even because we're just sharing our experience here. So I would like to say that we have we do know that we have huge potential for growth, like technologically, like grow for the partnership and maybe, often we asked, how can we help Ukraine or how we can help people in this situation? So we are not just asking for some types of help. We see that we are doing our work, we are doing our job. We are very high-level experts in software and product development. So just contract us, keep in touch with us, and develop our business together. And we have huge opportunities today, especially today. Thank you for attention, and I think some questions, yeah?
Thank you so much. I really, really enjoyed listening to this panel, and I think thank you for sharing your experiences. And what really came through was that, from great adversity comes great opportunity. And I think it's very clear that once this terrible situation is over, there is going to be so much that the rest of the world is going to learn from Ukraine. And we will be looking to Ukraine to see just how far you've come in this digital transformation. And I think what really resonated with me was that, you talked a lot about how ultimately digital health and health technology has actually just become synonymous with healthcare, except in very acute settings. And, I think that very much is aligned with the way the world is moving too. And there's clearly a lot to be learned from that. But what I was really fascinated to learn was, I know from my point of view, if I don't have signal on my phone or my Wi-Fi drops out on my computer, it's really annoying. And I'd never really considered what happens to digital health when systems go down. And so to hear that actually there are ways and approaches and solutions that are being built that actually are built to function offline as well as online is, I think, really incredible and sets us up, I think, for real success when, we face future pandemics and other disasters around the world, but also just generally speaking in life when the Wi-Fi drops out, which feels like a disaster at times. So thank you. And I have just one question before I hand over to the audience. And that is that with the pandemic, we also saw great digital transformation and a lot of healthcare moving to digital first. And as we've now moved out of the pandemic back into as real world as I guess we may ever get, there's been a bit of a repeal of that. So we've gone back to more of a split, I guess, of digital delivery and also face-to-face delivery of healthcare. And so I'm really keen to hear from each of you the one thing that you think is going to stick when we come out of the other side of this war in Ukraine, the one thing that you really think is going to hold tight and have the biggest impact. I know we heard about some predictions for the future, but what is the biggest and most valuable thing that people are going to hold on to and really come to expect from their healthcare?
Okay, so first of all, thank you for your question. From my point of view, the one biggest things which will came from Ukraine to UK or some another country is absolutely mix of offline and online services in one line. Because you can just imagine being in Ukraine for now. Let's imagine you are locked in your house for 7 days. And being in Ukraine, you are ready, and not you are ready, you are accessible to get all of those digital healthcare services in 7 days just online. Even if you don't have some telecom, some Wi-Fi, you can just text your doctor, you have SMS, and you'll book the appointment, and you'll have your delivery of pills. Yeah.
I have two things to say. The first one regarding COVID. Actually, in Ukraine, we were very early with digitalization in many topics, in banking, like neobanks for us. It's a nice thing that we already had starting from 2017, and like pandemics didn't change that. We just had it, as well as digital services from hospitals and etc. And using Zoom, etc. For us, it was like a normal thing, right? It just boosted everything around the globe. Another point is any war in history was the center of change for everything, right? It was the time when everything was revolutionized, when new ammunition was created, but also did we expect our smartphones, if we say after the Second World War, when everyone started to thinking, okay, let's create something like internet, I would say right now it's too early to say that there's something like the main thing or something that we can already raise and say that this will be a result of the war and that's what we will have. I think it's something we will see. Hopefully very soon.
Yeah, well, like I agree with Timur. It's something that we will find out when the war is over, but as of now, it is not. So we are still suffering. But in terms of something that will stick, if you put your mind to it, I think this whole situation in Ukraine, I know it's not something related to IT or digitalization, but it just raises the awareness about mental health and how important it is. Because if you're feeling well mentally, you can function as a part of society. But if you have any issues, which a lot of people are having right now, not just in Ukraine, it is a whole thing, I think that we should pay attention to it. And another thing that I think would be paid attention to is those people living in those rural areas, like you said, where we don't have access to internet all the time, or where they're not proper hospitals or proper consultants who can consult them. At least they will have a better chance at getting a better level of healthcare that they deserve.
So we already see the mix of robotics in healthcare and in my city, in Lviv, our city council launched the big program of helping people who was injured by some bomb with replacing their arms and legs with the robotic legs and arms, which are really humanized. So they are not like look like the something scary, but yeah, they look like the typical hand or typical leg. And now we see that this is like only a part of the problem. So the main problem, even not to replace like the hand, but to help with mental health after and to support this transformation, building new habits for people and build this sustainable like transformation of the person and get him or her to normal life. So and this project, which was launched pretty much quickly, just in 1 month after the war started, and it's already helped several hundreds of people that go through this project. And in my opinion, this is something that we will learn after as a case study for how to unite and how to bring disabled people back to normal life. So
yeah, and practical application of the technologies in absolutely new, let's say, scales, unfortunately, but it's crucial for people to continue living.
Thank you so much. Okay, so open to the audience. If I could ask you to state your name, where you're from, and also who you're directing the question to. Thank you.
Thank you. Hi guys, my name's Chris, I'm from Vodafone. Question's just probably general, I think. So it's mostly around the kind of domiciliary care setting, so mainly like people that are in their own home in some level of care, mainly think of the elderly or people with learner difficulties, etc. What kind of technology innovation are we either seeing in Ukraine or need to see to make sure that those people are either not being kind of left behind, can still stay connected with carers, and still kind of be supported by the people that they need to support them ultimately?
Okay, so one is that, as I already mentioned, we have a high level of digitalization in every sector in Ukraine. So moving around country, you still have connection to your doctor, and you can have a new connection set up online. That's no problem. The second one is our product that we developed for UK and Ireland market will probably make a good one here. It's something that is online, but both software and hardware. You have hardware in your home, you can set up it, and you can let an organization or another person to take care of somebody who's living in that home, right? Some core vitals are being monitored, the person's habits are being recorded, and if anything goes wrong, the system will alert the people that need to be alerted and need to take care. And you have a direct connection with the person that needs to be cared of. Yeah.
Thank you. All right, next question.
Hi there, my name's Sue. I'm actually from the UK Ministry of Defence, so Anton, you've probably met with colleagues of mine. Something that we've definitely discovered over the last few years in the conflicts we've been involved in, not exactly the same way, is that you get that spike, as you said, of innovation, but then at the end of the conflict it drops off. So how are you focusing and looking at how you don't lose that technology or technological advances and those innovations when the war ends, which hopefully will be soon.
Security in software really important. Like if to answer like how we can lose the technology, they could be broken. Yes, and digital security for every product becomes even more crucial than before. But maybe you know that like Ukraine, one of the leading countries in IT, so we are like making everything right from the first time, and none of our system in healthcare which I know was compromised. This is the first and very important actually thing, because there was a lot of attacks on the healthcare system, and especially knowing that our enemies know a lot of insights from our country. There was really targeted attacks. So another thing that like how to innovate during this period is to work with the end customer. Like though nowadays the end customer mostly they are our soldiers, and by working with them day to day we got the understanding what are the problems that they faced on daily. And then we brainstorming with the team and bringing them some solutions. And it's not always the IT solutions or not always like hardware solutions. Sometimes it's just a small improvements in the processes, or like a way of working, way of getting, for example, injured from the field. As an example, one of my company producing the unmanned drones that taking the soldiers from the battlefield out without like a man, and this really helps. Though it's could sound here like I don't know, that like something useless, but when you are facing with the so it's really helpful.
It's quite just on the top of age technologies, because we are not expecting robots taking people out of the battlefield, but it works, and it helps to save lives. And by the way, Igor wanted to. Thank you, Anton. we have extended.
I want
work.
just to remark to your question. So speaking how not to lose, from what I see, and it's my personal opinion, we are doing the same path as Israel do 40 years ago. So believe me, after the war end, conflict will not be ended because Russia is still our neighbor and so on and so on. So we have to continue to learn how to live far from them, near them, yeah. And I think we shall transform and adopt our technology not just for internal using, but for the export. And there are no one country in the world for now as Ukraine from which you can learn so much in just short period. Thanks.